Hi, I'm Colleen Healy. Thank you so much for having me here today. I'm an attorney with the Network for Public Health Law. I'm in the Mid-States region, so I'm in Ann Arbor, Michigan. And our region includes Pennsylvania. And I also work on some issues relating to community health workers. So I am here today to talk to you about using community health workers as members of the oral health care team, and really excited to be here. I've talked with Amy Requa and others and have learned about work around CHWs in Pennsylvania, and I know that there's a lot going on, and going on specifically in oral health. And there are other examples across the country too where CHWs, community health workers, are being used in oral health care teams. In New York, there was a program recently developed to use CHWs to develop and implement early childhood caries risk assessments, electronic risk assessments. And these used a broader range of risk factors than are normally used and involved kind of an educational piece and a goal-setting piece with families. In South Carolina, the Department of Health has been using community health workers to provide home visits and oral health education in the context of home visits, touching on oral hygiene, the importance of an early dental home, and other topics. And then in Washington State, they've been using a cavity-free kids curriculum, and this has been used to educate Head Start providers to share the information with families and children in the classes. And Amy has been adapting that curriculum for use in Pennsylvania. And she's used it to educate a variety of audiences and recently used it to conduct a train the trainer session so that community health workers and dental hygienists can use the information in their day-to-day practice. So why are CHWs important members of the oral health workforce? I have a list up here of barriers to oral health, and I wish I had had that list presented earlier because that was excellent and specific to Pennsylvania. But here's a list up here, and on the right the list on the left is from the Academy of General Dentistry, and the list on the right is from the Community Health Worker Core Consensus Project. It's the C3 project, and it solicited input from community health workers and employers across the country to identify the main roles that CHWs fill. And an important note about this list is that it includes kind of the range of functions, but not every community health worker performs all of these functions, and it's just kind of a broad list. And I just wanted to point out how the barriers to oral health align with the core roles of a community health worker and how well the CHW roles correspond to addressing those barriers. Many of these have been discussed today. Oral health literacy is a patient's ability to comprehend the information being shared with them, and the CHW can help both on the provider side of making sure that the message is culturally competent, making sure that the patient understands systems, understands their benefit system, understands how to get referrals. And the CHW can also be somebody that the patient is comfortable with asking questions. Patient activation is just referring to the movement from literacy to behavior change or healthy oral health behaviors, and a CHW is really well equipped to assist with this too. The coaching and social support is really important in this, and providing culturally appropriate information. And another major function, I want to jump down to number 9, outreach, since this has come up quite a bit today as well. CHWs often conduct home visits in many different contexts, in oral health care and primary care. And they might conduct this outreach in an emergency room and kind of redirect some of the patients in an emergency room to get either primary care or oral health care in a dental care home. And they might also perform some similar functions to what we just heard about in terms of the public health dental hygienist. By reaching out in community centers or senior centers, Head Start classrooms, they could also provide services in those areas. But more important than the roles is actually this core quality of a community health worker. This was identified through the C3 project and is often reiterated when speaking with CHWs. Their essential quality and the primary source of their expertise is through their membership in the community or their relationship with the community. And this is a really important piece to remember when you're hiring or training or working with a community health worker, remembering that they are the expert on the community and can help you to understand the community better. And it's important to realize that their key role is not clinical, and this distinguishes them from most other members of the oral healthcare team. They don't have clinical training, and that's not a piece of their work. They may have training in other areas, or they may have had on-the-job training, but it's not a clinical role. And so this also allows more community members to enter the profession and allows you to reach further into the community. It's really their membership in the community that is key to relating to clients, identifying barriers to oral health care, whether it's finding transportation to an appointment or why it is that maybe they're not compliant with a medication, and then helping to brainstorm solutions and doing that from the perspective of the client within their own community. This slide shows the definition of a community health worker from the American Public Health Association. A group was formed within APHA in 2000, or the statement was adopted in 2009 by the Community Health Worker Group. And I just wanted to point out again that the first piece of it is highlighting that a CHW is a member of or has an unusually close understanding of the community served. I'm running out of time, so I'm going to really quickly go over a couple of the issues that often come up next, which is who do we hire and how do we pay them. Some of the questions that come up with hiring a CHW that are being discussed in states across the country now and haven't really been settled, at least in a uniform way, are whether CHWs as a profession should be regulated. Should they be licensed or certified or registered or none of these? And do these types of regulation just create unnecessary barriers to entry, or are they helpful in gaining recognition of the profession? For training, there are different approaches in different states. Some require maybe 80 to 160 hours of instruction. Some allow on-the-job training, and some require continuing education. Some really don't have any regulation on this at all. And this is also an area of difference between many of the other members of the healthcare team you've heard about, and that training requirements vary. And finally, reimbursement. Many CHWs are paid for through grants currently, but in Minnesota, they allow for fee-for-service billing of community health worker services, but this is not the norm at all. And it's really been, different states have been looking at ways to incorporate community health workers into alternative payment models under the Affordable Care Act and using them as payment moves from volume to value. So I'd encourage you to remember the key quality of CHWs as you think about incorporating them into your work and think about today responding to community needs, that they are members of the community and can really help identify what the community needs are. And I have some resources up here that, if these are shared, would be helpful. So thank you very much.